Will stem cells grow me a new knee? They don't. Nothing does. Of all the questions my patients ask me, this is the most common and it deserves a straight answer. But before I give you mine, let me take you back to where we ended last time. In my last video, we saw something important. In an arthritic knee, one of the body's maintenance engineers, the macrophage, becomes trapped. Not because the cell is faulty, but because the environment around it keeps signaling danger. The fire inside the joint. Mootukku ul erichal. The fire inside the joint keeps burning, and I left you with a question. If the environment keeps those maintenance engineers trapped, can we change it? So, today two questions sit on my table. Hers, will stem cells grow me a new knee? And mine, can we change what keeps the fire alive? Let me answer both. For many people, the answer has become a single phrase: stem cells. You probably heard the advertisements. Stem cells grow new cartilage. Stem cells rebuild your knee. Stem cells give you a brand new joint. They don't. Nothing does. Not today. And you don't have to take my word for it. Take the word of the scientist who first gave them their name. Professor Arnold Kaplan coined the term mesenchymal stem cell decades ago. Years later, he said the name itself had become misleading. He suggested a different name: medicinal signaling cells. Now think about that. Why would the scientist who named them want to change their name? Because he believed we had misunderstood what these cells actually do. Their greatest strength may not be building tissue, their greatest strength is communication. They don't simply build, they signal. Signaling, what does it mean?
This model helps us understand knee pain. Targeted waves can stimulate cellular repair.
The maintenance engineer wasn't broken, it was responding to the messages around it. Every minute, that maintenance engineer is listening to thousands of tiny biological messages coming from the tissues around it. Some messages say danger is still here. Some messages say the emergency is over. It's time to settle. In osteoarthritis, the danger messages keep dominating the conversation. The joint remains trapped in a state of mootukku ul erichal, the fire inside the joint. Now comes the remarkable part. Medicinal signaling cells don't become your new cartilage. They don't replace your joint. Instead, they release their own biological messages into that environment. Those messages gradually change the conversation taking place inside the knee. Instead of hearing danger, 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 the maintenance engineers begin hearing something different. The emergency is settling. The damage has been dealt with. It's time to calm down. It's time to move from destruction towards balance. Not because the immune system has been switched off, but because those settling messages didn't arrive on their own. The medicinal signaling cells sent them. They don't fight the fire, they don't rebuild anything, they signal. And that is how the environment changes. Not by force, by signal. And when the environment changes, the behavior of the maintenance engineers changes with it. The fire, mootukku ul erichal, the fire inside the joint, can finally begin to die down. Not a knee rebuilt, a biological environment moving back towards balance. This completely changed the way I think about osteoarthritis. Earlier in my career, like many surgeons, I naturally focused on the damaged cartilage. Today, I still look at the cartilage, but I also ask a different question. What biological environment is that cartilage living in? Because cartilage doesn't exist alone. It lives beside synovium, subchondral bone, the bone just beneath the cartilage, Fat pad, meniscus, ligaments, immune cells, blood vessels, all of them are constantly communicating with one another. That is why I often tell my patients, your scan is not your story.
At first glance, these two knee x-rays appear completely identical. Both show mild joint space narrowing and slight. We see two an elite athlete, the other is a sedentaree.
Two patients may have exactly the same x ray. One has very little pain, the other struggles to walk. The difference often lies not only in the damage, but in the biology surrounding the damage. Patients often ask me, Doctor, which injection is the best? PRP? Bone marrow? Stromal vascular fraction? Something else? My answer is always the same. That is the wrong place to start. I don't begin by asking which biologic should I use. I begin by asking what is driving this patient's arthritis. Is it mechanical overload, persistent synovitis, subchondral bone disease, meniscal failure, metabolic inflammation, or several of these together? Because until I understand the biology, choosing a biologic is simply guessing. Treatment should follow diagnosis, not replace it. Many people ask me, so what does Prasad actually do? Let me answer carefully. Prasad is not designed to regenerate cartilage. I have never claimed that because today's science does not support that claim. The goal is different. The goal is to create a healthier biological environment inside the joint, to reduce the signals that keep the repair system trapped, to support a joint that is trying but failing, to return towards balance. That's why I think of joint preservation as much more than a single injection. It is understanding the biology, understanding the mechanics, and then selecting the right biological strategy for that individual patient. Let me be completely honest. If someone promises to grow you a brand new knee from a syringe, be cautious. That is not where modern science is today. I don't promise my patients a new knee. I promise them something much more honest. I will try to understand why the knee is deteriorating. I will try to find what can actually be changed, and if that biological environment can be improved, I will do everything I reasonably can to help preserve the joint they still have. This is a very different promise, but I believe it is a much more truthful one. Remember the lady from the previous video? Normal blood sugar, acceptable cholesterol, progressively painful knee, told it was simply age? This is what I tell her. I cannot grow you a new knee. Nobody can. But the fire inside your knee, muttuk ul erichal, the fire inside the joint is real. It can be understood, it can be investigated, and in many patients, the biological environment that keeps that fire alive can be addressed. That is a very different sentence from the learn to live with it. If your knee is swollen, stiff, or painful, don't just ask, what treatment do I need? Ask something more important. What is driving my arthritis? Because once we understand the biology, only then can we choose the right treatment. Thank you for watching. I am Dr. A.K. Venkatachalam. I will see you in the next video.